Mohammadpur Our, a semi-urban village in Haryana, a busy industrial area, and home to more than 4,200 households, 84% of whom are migrants. Many of the women and girls here have serious gynecological problems, mostly due to their poor menstrual habits. Drinking water here is unsafe, and most families suffer from common illnesses that turn severe. The good news being, almost all are easily preventable. 38-year-old Savita is a mother of 3 children and works as a domestic helper in 5 homes. Almost every week, Savita is down with a fever or an upset stomach, and in addition suffers from constant aches and pains. Many factors contribute to her poor health. The open drains near her house, unsafe drinking water, flies, mosquitoes and rats from the piling garbage, and poor sanitation facilities in the community. With no health insurance, Savita finds that the constant visits to the doctor drains what little she earns. So, she mostly avoids going to a clinic and hopes that these problems would just go away. On days that she goes to the clinic, Savita is forced to skip her work and ends up with no money for the day. Despite working very hard for a living, Savita can't seem to save for tough days like these. She can't seem to open a bank account because she doesn't have the required documents. And in her own words, even if she did not have enough to save. Savita's story is also the story of more than 64 million men, women and children across India. A comprehensive community-led and owned program that addresses these vulnerabilities can re-script the story. To enable this change, Swasti has designed the integrated community health and wellness model, now being piloted in Mohammadpur. How does the integrated community health and wellness model work? When Savita falls ill, she walks to the wellness center near her house. At the center, a trained nurse meets Savita. The nurse listens to Savita's problems and gives her the necessary treatment. She also promises to check on Savita to make sure that she is well. The nurse puts in her diagnosis and prescribes the required basic medication based on a doctor's advice. In a while, the nurse meets Priyanka, the community health facilitator from ICHW, and briefs Priyanka on Savita's illness. Health facilitators like Priyanka bring a range of services from ICHW to the community. Health facilitators meet members one-on-one to check on their health and follow up their treatment. They build awareness and influence behavior change on primary health in schools, community, workplace and among migrant groups. They refer members to registered doctors and link them to hospitals. They organize health camps and give subsidized impact products such as water filters, condoms, spectacles and sanitary napkins. They mobilize women into self-help groups and teach them about savings, life skills, health and nutrition. They also support members to access social entitlements and schemes such as getting pension, health insurance, Aadhaar card, bank account and subsidy for building toilets and houses. On the whole, the ICHW model focuses on 2 aspects of healthcare: prevention of illness and quality treatment. To prevent illness, we actively screen for high-burden diseases and conditions, use protocols for treatment, use data for prevention, provide healthcare products, train community for behavior change, and focus on key determinants such as sanitation, air, water, and food. We provide quality care through 24/7 medical advice over telephone and quality, affordable and accessible medical care through the Wellness Center and a network of healthcare providers. In all these ways, ICHW catalyzes improvements in primary healthcare and builds community self-awareness and resilience to lead healthy and fulfilling lives.
हमने घर घर जाकर उनको जानकारी देनी शुरू करी और बार बार हम प्रतिक्रिया लेते कि उनको हमारी जानकारी से कोई लाभ पहुंचता है या नहीं। पहले तो ये काम बहुत ज़्यादा असंभव लगता था, लेकिन धीरे धीरे हमने देखा कि कुछ सकारात्मक बदलाव आने लगे हैं और वो इस अपने पानी की शुद्धिकरण की तरफ बढ़ने लगे हैं। कुछ लोगों ने फिल्टर के कैन लेना शुरू कर दिए और कुछ ने अपने घर में उबाल कर पीना शुरू कर दिया।
सरोज दीदी ने बताया है, डॉक्टर बोले हैं इधर को पानी गंदा है, इसको उबाल के पियो। तब से हम उबाल के पानी पीना शुरू कर दिया।
सरोज दीदी हमारे घर पे आई थी, उन्होंने बोला जिसके जो प्रॉब्लम हो वो आप दिखा सकते हैं, हमारे यहाँ डॉक्टर आएंगे मंगलवार को। तो मैंने जनवरी में दिखाया। मेरे पेट में भूख की कमी थी, मतलब भूख नहीं लगती थी, खाना नहीं पचता था, तो उसके लिए मैं गई। डॉक्टर ने पूछा आपको क्या प्रॉब्लम है, उन्होंने बताया, मैंने भी बताई अपनी बात कि मुझे भूख नहीं लगती है। फिर उन्होंने दवा भी दी, दवा देने से मेरा फ़ायदा हुआ।
Through these 11 health camps, we almost reached out to 700 patients in the community.
हमने एसएचजी के ग्रुप बनाए। एसएचजी के ग्रुप में जो औरतें आसपास रहती थी वो एक दूसरे के घर भी नहीं जाती थी, लेकिन एसएचजी के माध्यम से वो 15 दिन में एक बार मिलने लगी और उन्होंने अपनी बचत शुरू कर दी।
The another component of the program talks about helping people to get their social entitlements. We have worked aggressively on that in this community because we have found out that most of the schemes haven't reached the needy people in the community.
मेरे को जैसे पता चला कि बैंक का खाता खुल रहा है, उसमें मैंने सुनीता दीदी की मदद ली। उसमें मैं हर महीने 2000 रुपये डाल के आती हूँ। मेरे घर में पैसे खर्च हो जाते थे, इसलिए मेरे उसमें सिर्फ रहे।
भाई बूढ़ा बुढ़िया ने कौन पैसे दे, घर में बर्तन ने बता, सरकार सबने दे तो हमने भी देवे।
तो उधर गली के तरफ गए हैं तो सरोज दीदी मिली, तो बोली कि आधार कार्ड बनवाना, वो फ्री बन रहे हैं सस्ती में, तो बनवा लो। तो हमारे घर वाले गए हैं तो वहाँ से कागज़ लेके आए फिर आधार का अपना। तो जैसे तब आधार कार्ड हमारा बना, जैसे खाता नहीं खुल रहा है, उससे बच्चों का एडमिशन नहीं हो रहा है, फिर ये हमारा आधार कार्ड बना है, जब जाके काम हुआ है जी।
ये प्रियंका ना जाए ना तो काफ़ी अब भी ना हारी थी, ये बेटा जाए के वो पर्ची वर्ची कट हो लाई माते। अब जब पीछे भाई हमने काफ़ी मिल गई।
ICSW is a marriage of medical sciences, social engineering and technology, and through this we are hoping to reinvent the last mile of the health system so that we can effectively prevent diseases that can be prevented and treat those in a quality and affordable way.
Partnership with Swasti has been really phenomenal. In fact, right from the beginning, when I was given the task to conceptualize this project, our head of ethical trading, Fiona Sadler, she was very clear that any project, even if we do it at a local level, it has to actually address one of our pillars, which relates back to our work in human rights.
In fact, we will be continuing this project into the coming year as well, and we have been approached by other industry partners to collaborate with us and extend the reach of the project.
I was really moved to see the 5 women health facilitators who are now the champions of the project. The confidence that they showed was amazing.
So we are trying to address ICHW through, in Mohammadpur through different routes, different channels, and we hope that we will be successful.